Hi everyone, this is Praveen here. Today I am going to share few of the things which are concerned about the Pantop HP Kit. So this is the medicine which is prescribed for the eradication or for the treatment of the Helicobacter pylori, which is the cause for the gastritis, gastroesophageal reflux disorder, and sometimes in the latest condition it may lead into severe stomach cancer of the stomach. So is a commonly used drug in the treatment of gastritis, peptic ulcers, and sometimes even GERD also. So this is the Pantop HP Kit, which is the combi pack of clarithromycin, pantoprazole, amoxicillin. It has three medicines. One is PPI, that is pantoprazole, that is to reduce the acidity in the stomach, and clarithromycin is a bacteriostatic which can stop the bacterial growth, that is H. pylori growth, Helicobacter pylori growth, and the amoxicillin which is a bactericidal, so which kills the H. pylori. We have strip like this which is marked with the sun and moon. Sun is for the morning dosage, moon is for the evening dosage. This is the antacid, that is pantoprazole, which has to be taken at least 20 minutes before food, and these two are the antibiotic, clarithromycin and the amoxicillin. These two has to be consumed after food in the morning. In the same way in the night also. So this is antacid, has to be taken 20 minutes before food, and clarithromycin, amoxicillin are the antibiotics, has to be received after food. In each pack we receive 6 medicines in a single strip, which cost nearly about 215 rupees at present, and this is a box of that strip. So strip containing 6 tablet, so like that 7 strips will be there in each box. The duration of this treatment is 14 days. So minor symptoms like intolerance and all to the medicines are acceptable. So later means severe conditions like itching, rashes on the body, puffy face and all, you need to consult your corresponding consultant, and you need to continue the treatment for 14 days, and after 14 days you have to consult your doctor. This has to be taken after the prescription of your consultant only, and self medication is not advisable. So this is about the Pantop HP Kit.
Excuse me, sir. I have few questions. Like if a patient forgets to take pantoprazole before food, whether he can take it after food?
Yeah, you can take it off. As I told, is a proton pump inhibitor and it is a prodrug. Prodrug means which is active in certain atmosphere only. So this is a prodrug which is active only in the acidic media. So efficacy, if you forget it, so afterwards if you take also, the efficacy of the drug may decrease, but it not cause any adverse effect. So better to take it as the in the before food only, means it is you can utilize the full efficacy of the medicine.
Okay, sir. If a patient feels better, like in 2 to 3 days only, if he feels better with his symptoms, can he skip taking these medicines?
Yeah, so better means you have to complete the course, that is 14 days course. If your doctor is modifying the course duration, then as per his advice you can take it off. At present the advisable duration is 14 days. So irrespective of your symptoms, whether you relieved or not, you have to, once it is a diagnosis as you are having infected with the H. pylori, so you better to continue till 14 days, and afterwards before stopping you consult your doctor and take the advice. As per the advice you just follow it off.
And one more question is, what if whether he will have any side effects, like general side effects which he can ignore or which he should consider?
See, it depends on the severity. So clarithromycin and amoxicillin, among these two, amoxicillin may leads sometimes a severe side effects. So if milder side effects can be ignored, like GI intolerance will be there. So
Like
means
diarrhea
loose motion,
or,
diarrhea and all will be there. So sometimes not means they are not equally severe in all the cases. So sometimes mild disturbance will be there, sometimes it's severe disturbance. So whatever the discomfort you have, it's better to bring these things into the notice of your consultant.
What is the proper time, like these medicines in the morning, and the gap should be either 8 hours or 12th hourly? This
It's
should be
better to
taken.
maintain 12-hour gap between the medicine, because the dosage is framed like that. So pantoprazole will be of 40 mg, clarithromycin 500 mg, and the amoxicillin of 750 mg. So it's framed for 12-hour duration.
Okay, sir. Thank you so much for clarifying our doubts.
Okay, thanks for watching the video. If you have any doubts, please write into the box. I will clarify. Thank you.